Very well. Well, I'm going to talk about the gut and gut health and how it impacts us. But what you find out very quickly when you start looking through the available information is that everything connects. So the gut, I think everybody knows by now that it connects to the brain. Everyone's heard of the gut-brain connection, but it also connects to the placenta, the gonads, the heart. It's involved now, we now realize, with a lot of the confusion that's going on about gender. Why is it, for example, that so many children now feel that they may or may not be a different gender other than the one that they were born into? And it turns out that what's going on in your gut is almost certainly affecting that as well. And a little bit of German there, which I know that any Germans, and of course the Dutch, the Netherlanders who are in the audience will know what this means. Alles verbindet, and that's actually derived from something that Ernst Haeckel said. He was a 19th century biologist who was very important, whose work was rather overshadowed, but he was the first monist. He was one of the first people who said, well, hang on, perhaps we shouldn't be thinking about different systems. Perhaps everything does connect. And everything that we've learned over the last century has led us inescapably to this conclusion. Everything does connect. And when you talk about gut health, it's important not to talk about it in a vacuum. It's very much part and parcel of total health. And I want to start off by trying to put this in a historical context. And because you can't really talk about gut health without talking about diet and specifically to do with prebiotic intakes, I thought I'd surprise you all with some very interesting work that has been done that has quantified or tried to quantify prebiotic intakes at different periods in time before the 21st century, where we're obviously in such a mess. Now, if you go back to the times BC in Mesoamerica, and this is Middle America, it's that isthmus that joins the American continents, there is a group of Amerindians who've been very well characterized. They're called the Oda or the Odom people. And based on an analysis of their architectural remains, what we know of their agricultural practices, we know that they're eating around 135 grams of prebiotic fiber a day, which is a huge amount. It's about a quarter of their total calorific intake. And we know what it was derived from: agave, beans, maize, and nopales. This is all very well characterized. If we come closer to the modern day, to the 19th century in Britain, and this is another population that's very well characterized, better, I would say, than the Mesoamericans. We know that they were consuming between 20 and 40 grams of prebiotic fiber a day, so not quite as much as the Mesoamericans, but still very significant amounts. Where are they deriving it from? One of the staple foods in the second half of the 19th century, a period that we call the mid-Victorian era, is something called Helianthus tuberosus, and you may be more familiar with that as in its vulgar name, the English name, which is the Jerusalem artichoke. This is a root vegetable. It looks a little bit like a mutated potato, very irregular, but it is full of prebiotic fiber, specifically phos and inulin. And they also ate very large amounts of different types of legumes. So, for example, pulses and beans and things like that. This is a pretty good estimate, 20 to 40 grams of prebiotic fiber. How do we do today? Well, the best data that we have, and this is taken from North American data sources, they're consuming very little fiber indeed, and Europeans actually aren't that much better. Total intake of 15 grams of fiber, and only about a quarter of that is prebiotic fiber. So today, average consumption of prebiotic fiber, which you need in order to support the good bacteria, is 3.5 grams. So the point that I want to make is here that if you look at this in using a long lens, we have declined, our intake of prebiotic fibers has declined very, very dramatically from 135 grams to 3.5 grams. That is that's an extraordinary shift in our intake of one particular class of nutrient. And I think that the evidence is now so strong, linking these fibers to overall health that I think that we can now legitimately call them essential nutrients. So our intake of this group of essential nutrients has declined from 135 grams to 3.5 grams. What impact has this had on the microbiota in the large intestine? Well, first of all, you have to take into account what are those fibers actually supporting. They are the exclusive growth substrate for lactobacilli and bifidobacteria. Those are well-known probiotic species, but not just those two. Those are the ones that everybody knows, but there's a whole bunch of others. I've just selected three almost at random. These are three more. All of these are gram-positive. They all utilize the prebiotics, which are structural carbohydrates. They all of them break them down. All these species are associated with all kinds of positive health outcomes. These are all probiotics, even although the last three of them are not particularly well known. And all of them break down prebiotic fibers into short chain fatty acids, including butyrate and propionate. And I'll come back to that later. But they also produce bacteriocins, which are antimicrobial compounds. So the more you feed these good bacteria, the more bacteriocins they produce, which kill off bacteria that you don't want, many of the gram-negative bacteria. They also are very good at killing off mold species, such as Candida, which you don't want. So the more of the good bacteria you have, the less of the bad bacteria and other unicellular species. These good bacteria are also producing microsomal mRNA, which is quite interesting and actually rather important. I don't know if I'll have time to go into all of that. And some things which are called MAMPs, and these are microbial associated molecular patterns, and they have a huge impact on the functioning of your innate and adaptive immune systems. So if you're eating lots of probiotics, you have lots of the good bacteria, and they're producing lots of mediators, which have knock-on effects on other aspects of the microbiota, but also on your immune system, your cardiovascular system, your central nervous system. The list goes on and on and on. And when Hippocrates said very famously that the root of ill health was in the gut, and the converse was also true, I would say that he was far more correct than he could possibly have known. All the research that has been done over the last half century or so, it has done a great deal to support this particular statement of Hippocrates. So if we look at this in a historical perspective, traditionally, because we've always eaten so much prebiotic fiber and we've encouraged the growth of these gram-positive species in the gut to such extent, the traditional microbiota, and you still see this in vestigial cultures today, it was characterized by gram-positive dominance. You had more gram-positive species there than you had gram-negative. The problem is, as these prebiotic fibers have been removed from the gut, the good guys, the good bacteria have been starved, they've diminished in numbers catastrophically, and their place has been taken by a number of other species, predominantly gram-negative species, such as Bacteroides. And in that same period, what we have seen is a huge increase in the non-communicable degenerative diseases, about a 10-fold increase. And I think the question we have to ask is, well, is there a link? What I'm going to show you over the next few slides is the idea that there is not just one link, that there are multiple links, and that we can actually trace using a kind of pharmacological or mechanistic perspective, we can make some very direct connections between the reduction of prebiotics, the change in the microbiota, and the enormous and diverse decline in public health that we've seen, particularly over the last half century. This was brought into, I think, very sharp relief by a huge meta-analysis that the World Health Organization carried out in 2019. And I know that many of you have rather negative views about the WHO, which is actually being run by a war criminal at the moment. And I have I'm very conflicted about the WHO myself. In general, I'm not supportive of most of its current political aims. But they did support this one study, which involved a number of scientists who I respect and some of whom I know personally. So I tend to believe this data. they came up with this idea that if you are eating higher fiber intakes, this was enough on its own as a single category of nutrient to reduce early, which means unnecessary or avoidable early death by 30%, which is huge, really, really huge. And they broke this down. Then they said, well, what you see if you increase your fiber intake is reduction of bowel cancer by 25%, breast cancer 20%. And I'm going to come back to these things a little bit later in the slides. You reduce the risk of heart attacks and strokes. Other people then looked at some of this data and revisited and said, well, you also protect against dementia. You protect against non-alcohol related fatty liver disease, which is really prevalent now, currently affecting 1 in 4 of the world's population and projected to affect 1 in 3 of the world's population by 2040. And you also, if you have higher fiber intake, you have better COVID outcomes. So if you have lower fibers, you have worse COVID outcomes. You also, if you're having a higher fiber intake, there is a degree of protection against Parkinsonism and Alzheimer's. And we think that there are certain types of gram-negative sulfate reducing bacteria that are involved here, but probably others as well, and a whole range of other pathologies. So getting the microbiota right does seem to be extremely important in terms of a whole range of health outcomes. And this was really a large study, very, very big numbers, very powerful and very significant data. It's not a good idea not to eat very much fiber. This is what's actually happening in the large bowel. If you're eating a large amount of prebiotic fiber, which we always used to do, you're supporting the growth of gram-positive saccharolytic species. I'm sorry about the jargon, but I think quite a lot of you have science in your backgrounds or you're practicing scientists. The prebiotic fibers are carbohydrates. We can't digest them. They pass intact into the large intestine where they are metabolized by these gram-positive species that use them as fuel. Now, because when the prebiotic fibers enter the large intestine, they're in the contents of the gut. They're in the lumen, in the center of the gut. So that's where the gram-positive bacteria tend to migrate. They go towards the center of the gut where the fibers are coming in. They break those fibers down and they produce short-chain fatty acids, and they can produce here, as you can see, AMPs. You can see in the top left of the picture, those are the antimicrobial proteins I told you about. Under these conditions, you don't really have very much contact between the overwhelmingly gram-positive bacteria and the colonocytes. Those are the cells that line the bottom of the picture. But there is some, and the microbe-associated microbial patterns that you have on the cell walls of the gram-positive bacteria are just tickling, the immune cells that you have in the lining of your gut. And the gut then responds with a kind of very low level, but entirely appropriate. It's physiological, it's a healthy level of immunological surveillance, low level inflammation, physiological inflammation. And the gut cell then, or the cell walls, then start to produce something called interleukin 18, which is really important in just keeping both the innate and the adaptive immune system ticking over, talking to one another properly, improving your overall ability to resist infection and not be allergic, amongst other things. So this is what's happened. The prebiotic fibers have been taken away. The numbers of your probiotic species, the green microbes, have been dramatically reduced, and their place has been taken by gram-negative microbes. Those are the little ones in red. Now, these do not use prebiotic fiber as fuel. They're actually proteolytic. And where do they find protein? They find it in the mucosal layers that line over the colonocytes. And because they're actually eating the proteins in the mucosal layers, they break the mucosal layers down and they come into direct contact with the colonocytes, our cells. Those are the cells, as I said, at the bottom of the picture. And because these are gram-negative microorganisms, they are coated in lipopolysaccharides. That's what makes them gram-negative. And lipopolysaccharide is one of the most pro-inflammatory compounds that we know of. So now suddenly, the cells that line the gut are not being stimulated in the right kind of way. They're not producing immunosurveillance. They're not producing a physiological level of inflammation. They are producing an extreme pathological level of inflammation, and they're pumping out inflammatory mediators in all directions, including something called LL37 and IL-18. And the worries that we have about these are, first of all, that they're involved with tumor progression. And now you can begin to see how having the wrong kinds of microbes in the gut might lead to an increase in cancer, as the WHO study showed. But you also find that these particular molecules, and one or two other things as well, are causing something called neuroinflammation. And neuroinflammation is something that you really don't want to have because it brings all kinds of problems in its wake. So first of all, you've got local problems because you've got the wrong population of bacteria in the gut, and IBS, which was really only characterized for the first time around about, I would say, you see the first descriptions of this, or what could be this, entering the literature in about 1940 or 1950. IBS is a condition that's hard to diagnose. We don't have any reliable markers. You tend to make your diagnosis based on a clinical assessment. It's not always it results in hospitalization. The records available to that we have, if we want to analyze incidents, are not particularly good. But the best data we have suggests that this particular problem, which hardly existed 50 or 60 years ago, it is now affects up to 14% of populations in the West. If we look at the more serious conditions of IBD, so you're talking about ulcerative colitis and Crohn's and things like that, the evidence is very clear that pediatric IBD is increasing almost everywhere you look. And adult IBD is rising, particularly in those countries which are newly industrialized and which are moving into a post-transitional kind of a diet. That is where the intakes of prebiotic fibers are basically falling off a cliff, and the microbiota is changing as a result. SIBO, you know, I can't quote you chapter and verse to say that SIBO is increasing because it hasn't been recognized for all that long of a period of time. Diagnosis isn't always very accurate. We do know how to diagnose it, but it isn't always well diagnosed. But it looks from the available data that SIBO is probably also increasing. I would be very surprised if it wasn't, because one of the things that we know increases SIBO is an intake of antacids, because bacteria can get through the gut, through the stomach, which is no longer producing enough acid to kill ingested microbes. They're getting to the small intestine. But also, if IBD is increasing, you get ileocecal valve scarring. The valve itself becomes less functional, and now you're getting microbes passing retrograde from the large bowel up into the small bowel. So IBD, so SIBO, I think from the people that I've talked to, I think it is increasing as well. But again, I would say I can't give you chapter and verse on this. Now, colorectal cancer, on the other hand, is most definitely increasing. And if you look at the rate of increase, it's actually quite staggering since 1995. So in the last quarter century, in young adults, the incidence of colorectal cancer has doubled. And not only that, but what my colleagues are seeing when these younger people are presenting for the first time is that in very many cases, the colorectal cancer has progressed to a far greater extent than they would have seen as a quarter century ago. So where people were being picked up with stages 1 and 2, they're now being picked up with stages 3 and 4. So something terribly wrong is happening locally inside the gastrointestinal tract. And the impact on the liver is enormous increase in NEFLD, which of course is draining the intestines. All the blood supply, the venous blood from the intestine goes initially to the liver through the portal vein. So all the toxic stuff that's happening in the colon is going to be impacting on liver health. And this is certainly one of the reasons why NEFLD has gone up in the way that it has. Now 1 in 4, projected to hit 1 in 3 by 2040. Systemic issues, well, cardiovascular. Well, yes, if you're pumping out a lot of inflammatory mediators from the gut including LPS itself, which actually escapes the gut and gets into the bloodstream, a condition that we know as endotoxemia. Of course, you're going to have more endothelial dysfunction, which means more hypertension, which means more coronary artery disease and stroke, and that's what the WHO studies showed. And because you are pumping out these pro-inflammatory tumor enhancing or cancer enhancing messenger substances, you see an increase in breast and prostate cancer. Now, there's some other things as well. That's not just pro-inflammatory, there are endocrine changes as well, and I'm going to come to that again later. Now, endotoxemia, I mentioned a minute ago, this is what happens when you have really intense inflammation inside the large bowel. What happens is that the colonocytes start to separate, and you get a breakdown of normal colonic epithelial barrier function. So things that should remain in the gut are actually beginning to escape into the bloodstream. And one of those, subset of those are small molecules or even large molecules like lipopolysaccharide, gets into the blood. That is what endotoxemia is. Its compound is highly pro-inflammatory. Now you're setting up foci of inflammation everywhere else in the body. But if the inflammation gets bad enough, you actually also get the translocation of microbes. Microbes can get out through the holes in the gut wall, move into the blood system, get elsewhere, and then not necessarily set up directly and obviously clinical infections, but we now know that that's involved in a lot of the increase in autoimmune disease that we've witnessed over the last generation. And it also is involved in the huge increase in toxic preeclampsia. And I'll come back to that later. Now, neuroinflammation is pretty bad news because if you have neuroinflammation, you get excessive microglial pruning. Now, your nerve, your central nervous system is incredibly dynamic. Every time you learn something, you forget something, the synapses are growing and forming, and they're being pruned back all the time. The brain is a very dynamic organ, not static at all. And the ability to think, to learn, to be Homo sapiens, and I'm using the Latin here, this is not a gender-related or cultural issue. Your ability to be sapient depends on your ability to form and break down new synaptic connections. I'm not going to get into the synaptic coding of memory and consciousness. That's a whole different area, which is interesting to talk about, but we don't have time. But if you have excessive microglial pruning, you're going to be more stupid. You'll be less intelligent fundamentally. And that's going to have an impact in the short term, but in the longer term, it's going to increase your risk of neurodegenerative disease. And if you have neuroinflammation in utero, you are more likely to develop a neurodevelopmental disorder. If you have it as an adult, you are more likely to develop a neurodegenerative disease and to lose IQ points. So you don't want to have chronic neuroinflammation. Another reason why you don't want to have chronic neuroinflammation is that you're going to have more pain. Now, the frequency of chronic pain is also increasing all around the world. And if anyone is interested in this, by all means, visit my blog. I wrote a post on this not too long ago. And there are cultural determinants here. There's all kinds of other factors that play a role, but the numbers of people in chronic pain for whom the medical profession is unable to provide adequate support are undoubtedly increasing globally. Affective disorders, including anxiety and depression, very much involved. If you have neuroinflammatory stress, you have those inflammatory disorders, you have sickness behaviors and reduced performance, and I'll come back to that a bit later. If you have chronic inflammatory stress for too long, then this pruning back of microglia and the pruning back of synapses will eventually culminate in the retrograde axonal degeneration and cell death. Now, two things are happening here. Firstly, you're getting a direct attack on the structure of the nerve cells themselves, which will eventually kill them. But the other thing that's happening is the brain is almost, I think it's between 25, it's about 25, 28% by weight connective tissue. Yeah, I know you haven't come across that before, but when you think about it, there's no structural landmarks inside the brain. There's no bones, there's no sinews. What there is a very large amount of extracellular matrix, which is this very diffuse structure. It's a microfiber matrix, a three-dimensional matrix. And what holds the different neuronal structures together that allows the brain to function as it does. If you have chronic inflammatory stress, this extracellular matrix is also being degraded. So not only are you directly killing off brain cells, you're actually destroying the microarchitecture of the brain, and you are therefore impinging on central nervous function in two very, very important structural ways. And this is probably why, if you have IBD, which means almost by definition you have serious dysbiosis, you have an increased risk of the neurodegenerative diseases, including dementia and Parkinsonism. And if, as I said, you're exposed to this kind of neuroinflammation while you're in utero because your mother is eating the wrong kinds of foods, the modern diet, if she's subject to social defeat, we can get into that too in the questions and answers if you want, then you have a significantly increased risk once you leave the womb of autism and schizophrenia. I will only say in passing that neuroinflammation also plays a role in seizure threshold. So if you have neuroinflammatory stress, you're more likely to have epilepsy and to have more fits and more serious fits if you do. But it also makes you more vulnerable to trauma-related brain damage. So if you're someone who's involved in contact sports and you have neuroinflammatory stress, you're going to lose brain cells very quickly. If you don't have neuroinflammatory stress, you'll actually be able to withstand being knocked about on the rugby field or the martial arts ring or cage, if you're that way inclined, and you probably won't develop brain damage. In fact, humans were designed to live a hard-scrabbled, knockdown lifestyle and not develop brain damage, and previously we didn't. It's the modern diet that has left us so vulnerable because it has left so many of us with neuroinflammation. So what's happening, what's connecting the gut with what's going on elsewhere in the body? Well, lipopolysaccharide, I've mentioned that, pouring into the blood, causing endotoxemia, risk factor for all kinds of problems. If you have the right bacteria, you're flooding your system instead with acetic acid, propionic acid, butyric acid, and these are really important, very, very good for you. They support health. They kill cancer cells, they're anti-inflammatory, they protect against neuroinflammation, as does molecular hydrogen, which you also produce in the gut if you're eating prebiotic fiber. Molecular hydrogen is a very rapidly diffusing and very effective antioxidant, and this will protect you against excessive oxidative stress as well. The right bacteria, if you're feeding them, are going to be producing polyamines, so spermine, spermidine, putrescine, and all the rest of those. And that's really important because they're local tissue growth factors, so they're involved in healing. If you have been injured, then you're going to heal more quickly if you have the right microbiota, because you're producing more of these growth factors. They're involved in all kinds of other modifications which have multiple effects in all tissues. And in addition to the transmission of sort of low molecular weight factors, you also have traffic from the gut to other tissues of a more complex sort. For example, in the vagus nerve, where we know that there's a retrograde transport of various enteroviruses, which are very linked to Parkinson's disease, as well as the sulfate reducing bacteria that I mentioned. That Parkinsonism it's not a disease, it's a syndrome. If you look at the astonishing complexity of what's going on inside the brain, inside your neurons, inside your glia, it's very clear you can end up with something that looks like clinical Parkinsonism from about 200 different starting points. So it's not all viruses, it's not all bacteria. There's other things that are going on here as well, but those are just two linked here. The alpha-synuclein risk factor, which I'm sure some of you have heard of, is linked to dysbiosis. And other metabolites is hydrogen sulfide, which is produced in the gut. If you're not eating prebiotic fibers, you're going to produce more hydrogen sulfide because you have sulfate reducing bacteria in the gut. Hydrogen sulfide is extremely corrosive, but it is also a grade 1 carcinogen. So you really don't want to be going down that particular metabolic route. And then microbial translocation. So it's not just compounds, it's not just viruses, it's pathogens of different sorts which are escaping the gut where normally they could be kept under control. They wouldn't be harming you too much. But what some very elegant experimental work has shown is that if you allow these microbes to escape from the gut and get into peripheral tissues, they will get into inside the cells in some of these peripheral tissues where your immune system cannot reach them, but the cells that contain them will express fragments of these microbes on their cell surface, which the immune system can recognize. And if those cells are in the beta cells in your islands of Langerhans, your immune system will attack them and destroy those cells, and you will develop type 1 diabetes. And if they're in cells which are in the synovial tissues in your joints, your immune system will attack them, and you will develop rheumatoid arthritis. And this is one of the reasons why we're seeing so much more autoimmune disease than we did a generation ago. The rates of most autoimmune diseases have been increasing by about 2 or 3% per year, every year for many years. So what are the range of CNS-related problems that dysbiosis is going to move you towards? Well, these are some of them. I'm going to quickly look at them in turn. Let's look at neurodevelopmental disorders and schizophrenia. We know that the neurodevelopmental disorders are increasing in all developed nations. In America, the increase has been spectacular. No coincidence that Americans eat the most ultra-processed foods and the least fiber. Schizophrenia increasing also. If you do the preclinical work and you expose, you're doing, your R&D and you're doing, say, rodent studies, what you find is that if you expose the mother rat while she's pregnant to certain inflammatory stimuli, then the offspring will develop not only neurodevelopmental disorders, but schizophrenia-like symptoms as well. And this, I think, is a nice mechanistic link between dietary change and the increase that we've seen in schizophrenia over the last clinical generation. What are the risk factors for neurodevelopmental disease and schizophrenia? Well, they include maternal obesity, diabetes, infection, and chronic stress, and all of these will increase the synthesis of inflammatory mediators, including interleukin-8, which is really under the microscope at the moment, but I don't think it's the only one that's involved. So there's your preclinical work, and endotoxemia is undoubtedly contributing. So get your microbiota in order. The affective disorders and pain, well, I mean, again, it's well known that depression and the anxiety states are all increasing. And we also see an increase in the numbers of deaths of despair, which I think is now well over 100,000 a year in the United States alone. So these are people for whom the exigencies and the pressures of life are just too much. They can't cope. We have become less resilient. And the microbiota seem to be very much involved here as well. Reported pain increasing also in children, and the microbiota are definitely involved here because not only do we have neuroinflammation, there's 3 different types of pain. Neuropathic, where you're getting deterioration of sensory nerve cells. Nociceptive, which is mostly caused by chronic inflammatory stress. And nociplastic pain. And nociplastic pain is a 3rd category where we believe the increase in the sensing of pain is due to neuroinflammatory stress actually in the pain matrix, which is a complex neuronal network that links midbrain and forebrain structures, which is where you perceive and sense pain. So the connections here have all been mapped out. We know that various microbiota metabolites affect your local pain sensing nerves in the body. We know that they create neuroinflammation. We know they damage blood-brain barrier function. We know that they increase the sensitivity to pain. Epilepsy is the microbiota affecting epilepsy, or I suppose I should say are the microbiota. Please excuse my grammar. One of the first clues that this might be going on is a paper that was first published, I think 6 years ago. Since then, there have been more, showing that bariatric surgery increases the risk of focal epilepsy. Bariatric, which is weight loss surgery. Now, weight loss surgery causes all kinds of problems, I mean, including the well-known bariatric divorce. Bariatric epilepsy is less well known. And we now have the beginnings of an idea as to what the connection consists of. We know that if you have a reduced fiber intake, you will move towards gram-negative dominance, you will develop endotoxemia and reduced butyrate formation. And butyrate is really important because it inhibits the enzyme histone deacetylase. And now, if you're no longer acetylating the histones around your DNA, you are creating epigenetic changes which directly lower the seizure threshold. And we know that butyrate is important because one of the well-known ways, nutritional ways of improving epilepsy is the ketogenic diet, which increases butyrate. So why does bariatric surgery increase the risk? Because if you eat bariatric surgery, you have to have very small meals very often. And if you look at the fiber intake, the fiber content of those types of meals that are recommended, it's practically zero. So you're going to have endotoxemia, your bloodstream is going to fill up with lipopolysaccharides, your butyrate levels are going to fall through the floor. Absolutely, you're going to have more epilepsy. So we've looked at pain, neurodevelopmental disorders, schizophrenia, epilepsy. What about intelligence? Well, first point to make is that the best data that we have suggests that since 1950, we've lost an average of as many as 10 IQ points, which is pretty bad news. And there's certainly an increase in dementia, with more to come. I'm going to quote now the ELSA Brazil study, which has just been published, which looked at the impact of diet on dementia incidence, which is very tightly related to IQ. And this quite large study found that the adults who consumed the most ultra-processed foods and were consuming the least prebiotics had a significantly faster rate of executive function decline and global cognitive decline. So their brains were being damaged. There's no two ways about that. And we know from other studies that the more ultra-processed foods you eat, the less prebiotic fiber you have, the more you see shrinkage and damage to the hippocampus. And the hippocampus is important because that's one of the few areas of the brain where you're continually growing and forming new neurons throughout your life. And they are getting up into the forebrain, and you need to keep on repopulating the forebrain because that's where higher executive function takes place, where a lot of cognitive stuff takes place. And if you are starting to degrade the hippocampus, it's structurally and functionally, your IQ is going to fall, and you're going to be more at risk of dementia. And the interesting thing is that we have this idea about hippocampal atrophy and dementia, but it's more and more likely to occur with age in Western populations, in industrialized countries. But recent work has shown, and this is from the some of the work that's being done by UCA personnel amongst the Tsimane in Bolivia, they have found that hippocampal atrophy doesn't really occur in vestigial groups of people, that is, people who eat the traditional diet. They tend not to get demented as they get older. Their intelligence doesn't decline. In fact, you know, the wisdom of the ancients, that's very much a cultural mean that has been with us. If you look through, you know, the cultural backstories in many parts of the world, it is the elderly who are considered to have the most wisdom. Not quite sure that that's true anymore, because we are eating a diet that ensures that as you get older, you're not going to get wiser. You're actually going to become more demented. And hippocampal health is really important. It's the key to memory encoding, mood regulation. It's damaged by neuroinflammation that stops hippocampal neurogenesis. If you have enough neuroinflammation for long enough, your hippocampus does atrophy, and then you're going to develop dementia and you're going to develop Alzheimer's. Before you get there, you're going to go through a whole series of sickness behaviors, because neuroinflammatory stress triggers something called the cell danger response. Now, the cell danger response is something, again, we have to put in a kind of evolutionary context to make sense of. Under what situations would you have developed neuroinflammatory stress in a pre-industrial age? And that would typically have been if you'd gone out and you'd become injured in battle, or as an accident or whatever. Bacteria will get into the blood, you develop a systemic inflammatory response to that. And what happens? If you've been defeated or you've been injured, you've been out on the hunt, what do? Well, what you have to do is you have to withdraw. You have to go to the back of the cave and hope that your body can heal. So what happens is neuroinflammatory stress triggers a series of behavioral responses known as sickness behaviors, and they include withdrawal, depression, loss of sociability, demotivation, risk aversion, and it's now also being implicated in anxiety and PTSD. And that's fine. That's if it's a short-term thing and your immune system works and you clear the infection, you recover, and you leave the cave and you go out and you participate once more in cultural activities of various sorts. But if neuroinflammatory stress is continued for longer, and it's no longer infectious, it's sterile, but it's caused by the modern diet, chronic inflammatory stress will then lead to initially memory problems and subsequently reduction in intelligence and over the longer haul dementia, which is what the modern diet and lifestyle is doing to us. A few more things before I wrap this up. And we'll talk quickly about polycystic ovary syndrome, preeclampsia, infertility, and gender dysphoria, which is a very difficult topic. If there's time, I'll get into periodontal disease. So let's talk about PCOS to begin with. A couple of Australian scientists, Tremelin and Pearson, I think, in 2012, were the first people to link dysbiosis to polycystic ovary syndrome. And I think their work was really beautiful. It's subsequently been supported by a lot of other scientists and other findings. And they had this idea, well, if you have dysbiosis, you're producing lipopolysaccharides and getting into the blood, you're causing inflammation, which leads to insulin receptor damage, insulin resistance, and then you have an impact on androgen production in the ovaries and you disrupt follicular development. And this story is looking very coherent now. It has quite a lot of support. And of course, I don't have to tell you that PCOS, the numbers of people, of women presenting with PCOS have far increased. I mean, compared to a generation ago, it's just there's no comparison. Toxic preeclampsia. Are we seeing more of it? Not possible, I don't think, to say conclusively yes or no, because records in different countries aren't kept particularly well, but we're certainly seeing more early toxic preeclampsia occurring in younger and younger groups of subjects. It causes neuroinflammation, which causes neurodevelopmental disease in the young and brain damage, both in the infant and in the mother. The latest idea about toxic preeclampsia is that it is fundamentally a disturbance of placental blood flow. It is an incorrect placental physical and circulatory development, leading to chronic inflammatory stress in the placenta, whereby the placenta is now drip feeding inflammatory mediators into the maternal circulation, which then cause, amongst other things, hypertension and various behavioral problems. Now, I mentioned before that if you eat prebiotic fibers, you increase the good bacteria and they produce butyrate and propionate. And they're exactly what you need to make the placenta work properly. So if you're producing more butyrate in the gut, there's less inflammation in the placenta. If you're producing propionate in the gut, you improve the placental microcirculation. Conversely, take the fibers out of the diet, you have dysbiosis, and now you have impaired placental circulation, you have more placental inflammation, you're moving towards preeclampsia. And you also, now we know, because if you're getting microbes leaving the gut, you now have a dysbiosis in the placenta as well. So when we talk about dysbiosis, most people would say, well, it's all about, the bacteria in the gut. Well, the bacterial population in the gut is quantitatively the most important microbial population, but every tissue, every organ has its own microbiota, including the healthy placenta. But if you have colonic dysbiosis, you're going to have dysbiosis in every other organ as well. And that has now been shown to include the placenta, which probably makes this problems of placental microinflammatory stress much, much worse. Can I say definitively that eating prebiotic fibers is going to reduce the risk of preeclampsia and PCOS? Actually, I can't put my hand on my heart and say it's proven, but if I were to put money on it, I'd bet the farm on it. That's how good I think the evidence actually is. Infertility and gender dysphoria. Well, infertility, I mean, that again goes without saying. Sperm counts are falling off a cliff. Male infertility and female infertility are at record highs, and gender dysphoria, is also at record highs, increasing dramatically. So let's talk about sex hormone formation, spermatogenesis, and sexual endocrinology, and the impact that this might have on gender confusion. Well, first of all, the most important point to make is that the gonads are immunologically privileged. What that means is they and a couple of other sites in the body are protected from the immune system because they're producing cells which are antigenically distinct from the parent, because they only have they only have half the number of chromosomes. So you have to protect them from the immune system. And the way that's done is that you create a situation within the ovaries and the testes where there is a very low level of inflammatory stress, which is actually an essential part, for example, in the testicles, both of testosterone synthesis and spermatogenesis. If you have chronic inflammatory stress occurring elsewhere in the body, it overwhelms this physiological level of inflammatory stress, and testosterone synthesis falls. And so does sperm counts. And the same thing happens in the ovaries. And what happens is that testosterone levels are falling in men. Androgens are being increasingly produced in women. And these are really important sex hormones. And amongst other things, they have an impact on the developmental of sexual secondary characteristics and brain development. They also affect, the way that you think and feel and perceive yourself. And these sex hormones are being moved all in the wrong directions by having dysbiosis, by not having enough prebiotic fibers in the gut. If you have PCOS, you have elevated testosterone. That's a masculine or a masculinizing hormone that's increasing in women. Testosterone is being reduced in men. And you also have serious problems with estrogen. Now, the estrobolome describes the total numbers of different microbial species in the large bowel, which have an impact on estrogen metabolism, excretion, and reabsorption. Now, if you have dysbiosis, which is now prevalent, you produce all kinds of bacteria which are pumping out an enzyme called beta-glucuronidase. And when that happens, then estrogen glucuronides, which would normally be excreted, they're broken down into estrogen, free estrogen, which is then reabsorbed. So your estrogen levels go up as well. And this is probably one of the reasons why puberty, the age of puberty, is falling in women. So this change in diet is having a very complex knock-on series of effects on the microbiome and then on your sexual endocrinology. And I'm not going to be, reductionist enough to say, well, this is the only reason for the increase in gender dysphoria that we're seeing. But I think it would be ridiculous to say it's not playing a role. And I will leave it at that because this is such a contentious and an emotive issue. Along with accelerated puberty, we're seeing increases in breast cancer, again, because of this a pathological increase in estrogen reabsorption and then estrogen levels. And interestingly enough, it looks as if the prebiotic fibers will be helpful here because they reduce the numbers of bacteria producing this glucuronidase and they lower estrogen, which is in many cases a very useful thing to do. So what do we do when you have this mess going on inside the large bowel? You simply add the prebiotic fibers back, you restore a physiological level of inflammation, you restore endocrinological normality. And here are some of the prebiotic fibers eventually that we actually use. And this is phosphoructooligosaccharides, very small molecules. When probiotic species utilize these fibers, they eat them rather like beads on a chain. They break them down linearly. So they go fructose by fructose by fructose. And because these molecules are very short, this reaction, the way in which the bacteria eat them, technically it's a fermentation, is very rapid. So we will use larger amounts of inulin, which is the same fiber but longer, which has a slower fermentation. We add more of this. This is 1314 beta-glucan from oats. And this is resistant starch from things like green bananas. The molecules are progressively more complicated, so they have slower fermentation rates. And you need to have all these different fibers and to have them in the right proportions because when this blend of prebiotic fibers enters the large bowel, everything is moving. And so the FOS starts this chain reaction first. It's moving the gut from being gram-negative to being gram-positive dominant, but it doesn't last very long. That's in the ascending colon, and then the inulin takes over, and the 1,3,1,4 beta-glucans and resistant starch. It's not as neat as this, of course. There's a lot of overlap, but it's really important not to use just the one fiber type on its own. You have to give prebiotic cover to the whole of the large intestine if you want to rectify the situation and move it back to some kind of pre-transitional, I'm talking about the dietary transition now, or the nutritional transition, going back to a time when the microbiota was healthier and we, all of us, enjoyed better health. So I've probably taken up a little bit too much time. Let me just